Well, good afternoon, everyone. At least afternoon if you're on the East Coast. Morning if you're in other parts of the country. Brandon Gare with the National Minority Equality Forum, and where we lead. We lead a webinar every Friday. We try to educate and entertain and tell you what's going on in the world of health. Today's program is very timely because we're talking about flu prevention. We're calling it "Going Viral: The Latest Trends in Flu Prevention." Our team at SHC does great work and has been doing it for years in the vaccine and prevention space. And Chinnie Ukachukwu, and she'll tell me if I got that right when she starts, is going to lead today's webinar with assistance from Leslie Zuniga-Rivas. We are a cat-loving, scorpion-hating bunch here today, and we're always ever ready and prepared. That's some things we discussed before we started. Just to help you out, if you have any questions that you'd like to ask of our panel today, please use the Q&A box below. But if you just want to keep the conversation going and make other folks that are in the chat or panelists aware of some information, please share that as well. And then if you have any announcements that you want to share with the folks in this healthcare space, please do. I'm going to share one right now. We have our 11th class of 40 under 40 applications are coming out. And so if you know someone that's interested or that you should be honored, please share the application with them. We'll put it in the chat box and have them apply. Applications aren't due till the middle of January, and you'll join the 11th class. So I'm certain we have some folks maybe on the panel or in the audience that would be interested. And without further ado, I'm gonna turn it over to Chinnie, and she's gonna lead the ever ready Chinnie, and she's gonna lead today's webinar.
Thank you, Brandon. You're too kind. Thank you for the introduction. Good afternoon, everyone. Welcome to our Friday webinar. It is National Influenza Vaccine Week, and we have two amazing pharmacists on the call today to discuss the timely subject, flu vaccines, how to increase flu vaccines in our spaces, especially in the communities that are underrepresented and have growing disparities with vaccine rates. So again, I'm Chinnie Ukachukwu, Senior Director for Quality Improvement and Equity from the Center for Sustainable Healthcare Quality and Equity. Whew, mouthful, SHC for short, but that's one of the centers at the National Minority Quality Forum. And I will be doing justice, like I said, to this topic with two amazing pharmacists, community pharmacists, and I'll give them a chance to introduce themselves. Over to you, Dr. Amari.
Good morning, everyone. My name is Dr. Shabnam Memori. Thank you, Chinnie, for the introduction. Thank you to NMQF for having me in today to talk about these important conversations we should be having. I am a population health pharmacist with Nova Script Central with Dr. Donnie John, and I'm also the Safety Net Health Equity Fellowship for Nova Script Central.
Thank you. Dr. Demary?
Hi, everyone, and good afternoon. Thank you for having us today to talk about this important topic. My name is Dr. Charis Demery. I'm the Safety Net and Health Equity Fellow at NovaScripts Central. I also partner with APHA, and I'm excited just to get the conversation started. Thank you.
All right, thank you. Now, before we begin, just a quick back story or description of who community pharmacists are, or what the Community Pharmacist Ambassador Program is. Here at the SHC, we have three pillars for community engagement with community leaders and clinicians, and one of them is the Community Pharmacist Ambassador Program. We recognize that community pharmacists are health educators outside of the pharmacy, and that they share sound, trusted health information and they help increase public recognition of the vital roles that pharmacists play in health promotion. Now, through this program, pharmacists are connected with community partners. They strengthen local efforts to improve health, and especially in underserved communities of color, where we recognize, again, like I said earlier, the pharmacists play a critical role in access and trust. Now, because of this, SHC has been collaborating for the past, say, 4 years now with NovaScript Central to power the Community Pharmacist Ambassador Program. And one of the disease states we've focused in for the past 4 years has been flu vaccines. And so we will be reviewing our updated flu vaccine modules created by NovaScript Central. Our goal today through this conversation is to walk through the updated modules, address flu vaccination disparities, and explore culturally humble communication strategies. And we hope that by the end of the conversation, you have we are able to communicate our clear call to action to you, which is that you should get the full shot if you have not, and that you should help someone else get it too. Now let's dive in. So, Dr. Anwar, I want to start with you. Let's talk about where flu is currently this season and what providers need to know. When you look going through module one, and Leslie, if you could just put the community pharmacist ambassador link in the chat so folks can look at it and so they can join us. They have an idea of what we're talking about when we say module one, module two, three, or four. Dr. Anwar, looking at module one. For people who are joining from diverse professional settings, can you walk us through the core basics of influenza and what makes this season, the 2025-2026 season, unique, especially given the ongoing ACIP deliberations? Just for those of you who are not aware, ACIP is met yesterday and they're meeting today. They usually give recommendations around who gets vaccines, why they get the vaccines, and what kind of vaccines they should get. I'll pass it off to you, Dr. Amari.
Thank you, Chinny. Absolutely. I'd be happy to answer the first question. When we look at the core basics of influenza this season, one of the most important things to recognize is that we're continuing to navigate what many describe as a triple-demic environment. So influenza, COVID-19, and RSV are all circulating at the same time. And because their symptoms often overlap, our emphasis is on prevention, particularly vaccination, and it's even more urgent for the 2025-2026 season. So NovaScript Central has an infographic differentiating the signs and symptoms of influenza, COVID-19, RSV, and the cold that Chinny can share with you all after the session today, and that is also included in the modules. So
Awesome.
no,
Go ahead, finish up.
Module 1 highlights the groups at highest risk for severe flu, including children under 2, adults 65 and older, pregnant individuals, people with weakened immune systems, and those living with chronic conditions such as asthma. We also want to emphasize the relationship between flu and COVID-19. Both viruses can cause severe disease, with COVID-19 still carrying a higher mortality rate. Several studies have actually shown that individuals who are not vaccinated against the flu have actually had greater risk of COVID-related hospitalization and complications. So another essential reminder in this module is that the flu vaccine is needed every year. Influenza viruses do change, vaccine strains are updated annually, and yearly vaccination remains our most effective tool to reduce severity and the spread. To answer your question about what makes this season unique and why the December ACIP deliberations are so important, is that we want to be operating with the most up-to-date disease burden data. So ACIP reviews all the evidence on vaccines and works to create the official annual U.S. vaccination schedule. ACIP's accurate review of the most up-to-date disease burden data is crucial to ensuring the annual vaccine recommendations are up to date. So, for example, adult flu vaccination coverage for the 2024-2025 season reached 46.7% by April 2025, but we do continue to see worrying declines among younger adults and across many minority communities, which is why our conversation today is so important. For children, vaccination rates remain 8.3% lower than pre-pandemic levels, and these disparities reinforce why pharmacists and community providers play such a critical role. Pharmacists continue to be among the most trusted and accessible vaccinators. We have administered hundreds of millions of COVID-19 doses, and we serve as a key access point for flu vaccination, especially in these communities facing structural barriers. So to summarize my answer, Module 1 does have sharper data-driven message that vaccination rates are slipping, the risk remains significant, and the season's overlap of flu, COVID-19, and RSV makes timely vaccination more important than ever. So our role as community pharmacists and health ambassadors is vital in closing these gaps that I'm sharing. Thank you, Chinny.
Amazing. Amazing. Thank you so much.
Thank
So
you.
basically, I would say, yeah, just if I could add anything at all, that this foundation helps us anticipate that where the guidance may shift and that messaging for patients must remain steady and evidence-based. Thank you. Thank you so much.
Thank you.
All right, over to you, Dr. Mary. This flu season, this flu season's vaccines are now fully trivalent with an updated H3N3 component. What should pharmacists and providers be emphasizing to patients about these updates and the timing of vaccinations?
Yeah, of course. So I feel like as we move into the season, the key message that pharmacists and providers should really keep at the forefront is really clarity. And even though ACIP is still working through some of its decisions and discussions, what we do know is clear. And that's that this year's flu vaccines are all trivalent. And the H3N3 component was updated to better match the strains we're expecting to see circulate this season. So, like we were talking about how it's trivalent, and that's just simply talking about how it protects against three different influenza strains, two that are type A viruses and one that is type B. But the H3N2 update is especially important just because this strain tends to cause more severe illnesses, and it spreads more easily in certain populations. And one way I like to explain it in community settings, I love an analogy. So you can think of the flu vaccine like preparing for winter. You just need the right layers for the conditions ahead. So you can think of each strain as its own specific layer for protection. And basically this year, the H3N2 layer was strengthened just to better match like what's circulating around right now. And the main takeaway for patients is really straightforward. The vaccine was just updated purposely, and getting it now gives them the most relevant protection for the season ahead. When it comes to timing, I feel our guidance really shouldn't change. We still need to encourage people to get vaccinated as soon as it's available, so ideally in September and October. But also, we want to remind and educate them that even if they don't get it in September, October, it's still worthwhile getting later in the season. And you can also think about this like sending your kids to school, even if they miss the first day, they still need their supplies. So we all know how school works. Once kids get like the sniffles and start spreading their cooties, for lack of better words, it starts spreading really fast. So flu really isn't much different. So if a patient is in front of you that is healthy, willing to get the vaccine, and the vaccine is within reach, you should give it. I think the worst message we can send is just to tell them to come back later or that we'll worry about it later. And for my last point, I think we should just remind patients also that flu, COVID, and RSV continue to circulate at the same time. So vaccination is really the most straightforward step to prevention, especially for severe illnesses. And even as ACIP still kind of fine tunes their recommendations, our message for patients should still be the same. Go get vaccinated, get protected, and don't wait for like that perfect information to do something that can already save lives.
Wow, brilliant. Thank you so much. Thank you. So one thing I want to point out is that the modules that we've created together are designed to be workflow ready. They're designed to be practical scripts, and they have strategies and links that you can use immediately. Speaking about scripts and resources, I'd like to share, I want to make sure that when everyone leaves this webinar, everyone knows exactly what resources are available to them and how they can use them. So I'm going to share 3 resources that the SHC team created with some vaccine experts for different audiences. The first one, I'm going to share my screen. Let me know if you can see the screen now. Okay. Oops. Did I go away?
Oh yeah, I think it clicked back.
All right, let me try this again. Can you see it now? Yeah?
Yes.
Okay. So this first one, and I'm trying to move you all the way, and I moved the screen away again. Uh, okay. Leslie, are you able to pull it up?
Yes, give me one sec.
Thank you. The consumer one is what I want to start with, please. Thank you. So while she's making it bigger, I just want to talk through a few things. A few things I'd like to highlight about this vaccine that we created for consumers is that It has plain language. You can see what it says here. It says vaccines, it talks about what vaccines are. Right there. Keep scrolling, please. Thank you. What vaccines are, how they work, right? And why they matter, especially during the respiratory illness season. It also names the realities that not everyone gets the same protection, highlights racial ethnic disparities in vaccination and outcomes. Some of the points I also want to make about this resource is that vaccines don't just prevent illnesses, they save lives on a massive scale. Vaccines train the immune system. Can you go to the next page, please? Vaccines train the immune system, antibodies and memory cells so they can respond faster later. Mild side effects like sore arms and low fever are normal after a vaccination happens, and they usually mean that your body's building protection. And that vaccines are not just for kids, but for everyone, especially older adults and people with chronic conditions. So basically, what this handout is saying to you is that trusted sources, this handout points to use trusted sources where you can get vaccines. It helps bust myths that people may have about, especially the flu vaccines. And it gives you access to where resources are, especially a vaccine locator, so you can find a vaccine close to where you are. Thank you, Leslie. Can we pull up the other one? I want the patient one now. The provider one, I'm sorry. The provider, then the patient. Thank you. So this is one that we created for beauty providers. We understand that providers, there's a lot of shifts in messaging. We understand that a lot of providers don't have access to CDC websites anymore. And so what we've done is compile a list of trusted resources that providers can access, such as the AAFP, the AAP. These are scientific bodies that continue to use evidence-based and scientific research to put their recommendations, and providers, especially busy providers, can simply go in there to show what's updated, what folks need to know. It also shows, it also has the not just flu vaccine resources, but also like Dr. Amory and Dr. Demery pointed out, COVID and RSV vaccine resources, because all of these diseases happen at the same time. Can you keep going, please? And then, sorry, can you go down a little bit? One thing that it shows here is by age. It shows where providers can point folks to by age, whether you're a child, whether it's for adults, whether it's for pregnant women, they know exactly where they can get the resources. Can you go down, please? So another thing that providers may struggle with is about insurances. What if folks are not insured? What if folks have different kinds of insurances? It helps answer those questions. So it really puts these tips at the hand in the fingers of providers, so they don't have to scatter around looking for other resources or where to send their patients to. They have answers on the tips of the fingers that they can send their patients to, and their patients can hopefully make take the desired action, which is to get the different vaccines. And then finally, can you pull up the patient one pager? Thank you, Leslie. All right, so this is the patient one, and it is something we call information that your family can trust. So we hope that this will be more readily accessed by everyone, but mostly people who are living with one chronic condition or the other, who have certain diseases that they're managing. And it again gives you resources not just for flu, but for COVID vaccines and RSV. It tells you again what shots to get, what shots to ask your provider for. It has resources that folks can click on right away, especially if you have the the online version. You click on any of these logos and you should be taken directly to their website to get resources or get answers to questions that you may have. The find and schedule respiratory vaccines from Pfizer is a very wonderful tool that folks can use also to get to find vaccines around them. All right, so at this point, thank you, Leslie. I'd like to welcome Dr. Amory to please share a point to one resource that you'd like folks to get off this call with as something that they can turn to for answers to questions, whether it's a family member, whether it's a provider, something that they can use to make the desired response to our call to action, which is to get the flu vaccine and help someone else get the flu vaccine.
Yeah, of course. So one website that stands out to me or resource is immunize.org. Actually, for the modules that Chinnie has shared, we have used a lot of our information comes from immunize.org. This site is actually an exceptional resource for both health professionals and consumers because it provides that accurate, evidence-based, and up-to-date vaccine information in a format that's easy to understand and apply. This organization actually works closely with the CDC and other national public health partners, and this ensures that the guidance reflects the most current recommendations, including that ACIP updates, clinical guidelines, and emerging best practices. Specifically for health professionals, immunize.org offers clinical checklists, standing orders, vaccine administration guides, storage and handling tools, and patient education materials that streamline workflow and improve vaccine safety. And then for those consumers, it provides reliable, accessible information that helps individuals understand vaccine schedules, disease risk, and the importance of immunization. So immunize.org bridges the gap between complex scientific data and practical user-friendly resources, making it one of the most trusted and widely used vaccination tools in the field.
Thank you so much. How about you, Dr. Demary? Is there one tool you'd like folks to get off this call to and look at?
Yeah, I actually kind of want to echo what Dr. Anwari was highlighting about immunize.org, but a little bit from like a slightly different angle, just especially because a lot of us on the call work with community-facing community or community-facing. So we follow like the ACIP based guidance, but we also recognize that patients and even providers are kind of navigating a tough time right now, just with not being able to have full trust in like those large federal institutions. And it definitely looks different now than it did like a few years ago. And that's why I feel immunize.org is really like a valuable tool. Just like Dr. Anwari was saying, they turn that straightforward or like core science information into like straightforward practical guidance that you can apply in real world pharmacy settings. Just like she mentioned, the influenza standing order, the quick reference sheets, and the multilingual handouts, they give you exactly what you need without having to sort through like those pages of like evolving updates. And for pharmacists, it's especially helpful, especially when you're like counseling those hesitant patients, patients that come from communities where they have shown historical mistrust. And it really just makes it easier to select the right vaccine, review the contraindications, and communicate in that plain language. Some other resources to mention is also vaccineconfident.pharmacist.com. And another resource is www.pharmacist.com immunization/center. And these are both APHA resources as well that are really, really good. So those are just some resources that I would also recommend for
Absolutely.
pharmacists and other providers to get
Yes.
to.
Yes, thank you so much.
No problem.
So that's a lot of resources that we alluded to, mentioned, shared. But one thing we ask is that this week, this season, that you go ahead and look through one of those resources and use it to make a decision, help someone else make a decision. And yes, we will, like Dr. Amory said, we will be sharing all of those resources compiled with the ones we shared in our follow-up email after the webinar. All right, let's go to Module 2. Module 2 is about health disparities. Dr. Anwari, we continue to see lower flu vaccine uptake and higher hospitalization burden among Black, Hispanic, and American Indian, Alaskan Native communities. From your perspective, what's driving these disparities? What tells you that the gap is widening, and what drivers are most fixable, especially within pharmacy practice?
Yeah, that's actually a very, very important question, Chinny, and I'm glad you asked it. So, when we look at the persistent gaps in flu vaccination among the populations you just mentioned, the Black, Hispanic, American Indian, Alaska Native communities, there are higher hospitalization rates in these communities, and it becomes clear that these disparities are driven by a combination of person level, provider level, and system level factors working together. So, we can begin by talking about the person level. We continue to see medical distrust, concerns about vaccine safety, and uncertainty about the seriousness of flu. These fears are not just misinformation problems alone, they're actually rooted in historical inequities and lived experiences that Dr. Demery mentioned just now. And they're actually reinforced by voices people trust the most, unfortunately, such as family, faith leaders, and community networks. At the provider level, there are several missed opportunities, and it remains one of the most fixable drivers. When pharmacists and clinicians don't make strong, consistent recommendations, or when materials aren't available in that patient's preferred language, we unintentionally widen this gap. So even small workflow practices like failing to offer vaccination at the checkout or during routine interactions, this can all add up over time. These are areas where pharmacy can make immediate improvement. And then moving on to the system level, structural barriers continue to shape access. For example, transportation, cost, long work hours, childcare challenges, and limited availability of culturally or linguistically appropriate care. So many of these communities are also targeted by concentrated anti-vaccine ecosystems on social media. So this will deepen the mistrust and widen disparities.
Thank you. Now, we've heard flu vaccination is at its lowest in about a decade in some recent reporting and
Mhm.
dashboards. What does this translate to in community? How does this impact these communities that we serve?
Yeah, for sure. So we know the gap is widening because flu vaccination rates are at now the lowest point in roughly a decade, and that decline shows up dramatically in the community, specifically with higher emergency department visits, more missed work and school, outbreaks in long-term care facilities, and an increasing strain on retail pharmacies that we already know are stretched thin. Lower vaccination rates don't just affect individuals, they actually ripple through the entire system. The good news is that many of the most impactful drivers are fixable within the pharmacy practice. Pharmacists can make strong, presumptive recommendations at every visit, offer walk-in appointments, provide culturally tailored education, use multilingual materials, and they can also partner with trusted community organizations to meet patients where they are. These are just some practical, actionable steps that reduce barriers and can build trust. So ultimately, addressing disparities requires actions at all three levels, but pharmacies are uniquely positioned to move the needle quickly. So by tightening our workflow, strengthening our communication, and deepening community partnerships, we can make vaccination more accessible, more equitable, and more trusted across the populations that need the protection the most.
Absolutely. And that's exactly why I asked those questions because I wanted you to point those out so that people see that these are
Hmm.
practical things that can be changed quite easily. Because
Hmm.
no matter what ACIP announces, the equity challenges remain, right?
Absolutely. Hmm.
Yeah. So Dr. Demary, Module 2 also outlines social determinants of health, such as transportation, cost, work schedules, and all that. What's one workflow change that pharmacists can make this week or this season without adding staff that reliably increases flu vaccination uptake?
Yeah, absolutely. So I feel like one of the more important things that Module 2 teaches us is that small intentional workflow changes can really make all of the difference, especially when we're trying to overcome those barriers you mentioned, like the transportation, the work schedules, the cost, and the mistrust. And if I feel like a pharmacy could make one change, it would be to implement like a recommend and vaccinate protocol at the point of pickup. So how that would work is like every time a patient comes in, and to pick up a prescription, especially those managing chronic conditions, the technician or the pharmacist just can offer the flu vaccine right then and there. And within that, it doesn't create any additional staffing, any additional resources, and it really reduces like those missed opportunities dramatically. And this approach works because pharmacists are really the most accessible healthcare providers in the US. A national analysis shows that about 48.1% of Americans live within 1 mile of a pharmacy, 73.1 live within 2 miles, and then nearly 89% live within 5 miles. So just with those numbers, like that proximity means everything. We can see patients more often, we can see them more conveniently, and almost at any other part of the healthcare system, honestly. We are like the more accessible one. So just being able to leverage and touch point that with like a simple, consistent workflow change can really increase like vaccination uptake across many populations.
No doubt, no doubt. And can we highlight who these patients are who are most likely to be missed in community right now, and what outreach approach can actually address that missed opportunity?
Yeah, absolutely. So I feel like as far as like who's most likely missed right now in our community, it's often like the individuals whose schedules really don't match up with like the pharmacy hours, like the traditional 9 to 5 or 9 to 7 hours. So I feel like we most likely see like night shift workers or hourly workers that usually sleep during those pharmacy hours are kind of missed, as well as caregivers, who often prioritize other people's health before their own. And I feel like we also see a lot of like refugees, immigrants, just those minority communities that face like those language barriers, the mistrust, and just the fear of like engaging with like those formal systems. And I feel like one way to combat this is by bringing the education and kind of access to them where they already trust and frequent. So like you could bring the information to like the faith centers they go to, possibly food pantries, community centers, workplaces, or even like the apartment complexes. Because here at Nova Scripts, we actually go directly into the communities to educate. For example, we educate at Lorton Community Center, also at the Wellness Center of Adults in Fairfax County. We also have been invited to come to some faith-based organizations like mosque, several different churches and temples. And honestly, wherever we're welcome, we're absolutely happy to go. And I really feel like when families see that pharmacists are showing up like where they are, instead of asking them to kind of rearrange what they're doing to reach us, it just helps build that trust. It really reduces the fear and it removes many of like the social determinants that are discussed in Module 2. So I really feel like just with incorporating one workflow change in the pharmacy and possibly like one community outreach effort, we can definitely take steps towards like narrowing the vaccination gaps this season.
Absolutely, absolutely. And I will also shout out pharmacists, especially all the pharmacists who've been working with our Faith Health Alliance, where we have seen continued growing numbers of vaccine rates because of pharmacists who are willing to, like Dr. Demery said, come to into their spaces to provide an option for folks who may not be available at other times or regular scheduled times that the pharmacist may have. Thank you. So let's shift now to Module 3. Communication remains one of our strongest tools. Dr. Anwari, can you talk to us about the importance of reflective listening and empathy, particularly as ACIP guidance is being reviewed in real time? What's the best way to communicate uncertainty without weakening trust? What's your steady message no matter what changes?
Absolutely, Chinny. Yes, I can. So, as ACIP guidance is being reviewed and updated in real time, as Chinny mentioned, reflective listening and empathy become even more essential. Module 3 reminds us that effective communication is not about having the answer immediately, it's about how we show up, how we listen, and how we make patients feel in moments of uncertainty. So, reflective listening is one of the most powerful tools we do have. So, phrases I like to suggest is it sounds like you're unsure about, or you're wondering if this change affects you. This signals to patients that we're not dismissing their concerns, we're taking them seriously, and people feel heard. They are far more likely to be more open to accurate information, and even when recommendations are shifted, they're open to that change. When it comes to communicating this uncertainty, the key is to acknowledge it without amplifying the fear that they may have. Patients don't expect us to predict every update, but they do expect us to be honest and steady. So a simple approach I would like to recommend is that ACIP is still finalizing guidance and we're watching it closely. What we know for sure is that vaccination remains one of the best ways to protect yourself and your family, and we'll keep you updated as soon as new information is released. This conversation through these statements, this keeps the door open, maintains that trust, and also reinforces that uncertainty does not equal danger. Cultural humility also plays a big role here. When patients see that we're open to learning from their perspectives rather than trying to master their culture, they do feel more comfortable and ask questions and voice concerns. That humility strengthens the relationship and reduces hesitancy. And to answer the final question you had with that steady message, my steady message is that regardless of ACIP updates, it will always be getting vaccinated is one of the most reliable ways to reduce severe illness, protect your loved ones, and keep our community strong. That core message
Absolutely.
will not change. Exactly. Even as specific recommendations can evolve. So ultimately, trust isn't built by having perfect answers. It's built through the empathy, transparency, and showing up for our patients and letting them know that we're in this together, even when the guidance is still unfolding.
Absolutely. When guidance shifts, clear and compassionate communication becomes even more important, is what I heard. Thank you for
Absolutely.
that.
Thank
Thank
you.
you. Model 3 also draws, like Dr. Amori was starting to talk about, on cultural competence and cultural humility. Dr. Demary, why would you say cultural humility is so vital when speaking to patients about flu vaccinations?
Yes, so cultural humility is honestly essential when we're talking to patients, especially about vaccinations or flu vaccinations, especially in a season where the guidance can really shift and misinformation can spread very quickly. So in Module 3, we make a important distinction between like cultural competency versus like cultural humility. In cultural competency, it really just implies that's like how we can somehow master like someone's culture. But cultural humility, that just reminds us that every patient comes with their own stories, their own beliefs, and their own types of lived experiences. So when we're leading with that humility, we're able to give patients permission to share those concerns without feeling judged or dismissed. And that's really where we're able to like build the trust with them. And for many patients, particularly those from like immigrant communities or refugee or even minority communities, their interactions with the healthcare system hasn't always been positive. So it's really important. That when we're using cultural humility, we're like slowing down, listening, and especially with intention, just to show them that we're trying to understand and not override their perspective. And ultimately, that's like the sense of being like genuinely seen, respected, that opens the door to like vaccine acceptance and expertise. It does matter, but trust is what truly moves people towards action.
Thank you. Thank you. Now, I'm going to ask you to give a 20-second cultural humble script that works when someone says, I'm not sure I trust the flu vaccines, or I got sick the last time I got a shot. Also, what's a common, well-intended phrase that can backfire, and what's a better alternative?
Yeah, of course. So I feel like whenever I hear someone say, I'm not sure I trust like flu shots or the flu vaccine, or maybe they say like I got sick after I got the vaccine, this is like a short, like 20 minutes response that you could say. So I would reply with them saying like, thank you for sharing that information with me. It really makes sense that you feel unsure, especially if you had those experiences in the past. And if you're open to it, I can walk you through how the vaccine works, and what we typically see after the shot. But my overall goal is just to help you feel confident in whatever decision you make. And I feel like this approach really just acknowledges like their concerns, it validates them, it invites like kind of like that open dialogue between you guys, and it just avoids the pressure of them feeling like you're like forcing a vaccine on them. Because we all know like once we force or try to force someone to do something, kind of the opposite happens is like they don't want to get it. And that's just like a good example of like a response that can kind of get someone to move into action with getting the vaccine. Intended phrase that I feel like can backfire is usually when doctors say like, "It's science, just trust it." And even though they may think it can be like reassuring to some patients, it can come off as like more dismissive, and it doesn't really help build that trust with the patient. So I feel an alternative response to that is kind of like, here's what we know from years of research, and hear how it protects people's in similar situations to yours. So it kind of relates it back to the patient, and not just centering science around it, but it also keeps the tone like a partnership or a collaboration rather than you kind of just telling them what to do.
Great, 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 great. Thank you so much. Now, can you share, I'm sure you've heard some common myths that you heard this season and how you approach correcting patients without overwhelming them.
Yeah, so we always hear myths circulating around the flu vaccine. And a few common ones that we always hear is kind of like the flu vaccine gave me the flu, or I'm young and healthy, I don't need it, or natural immunity can be better than actually getting the vaccine. And there's also still some like ongoing concerns just about like fertility, and interactions with RSV or COVID-19 vaccines. So I feel it's really important when you are hearing this mess and kind of addressing them, that you try to keep the conversation like really grounded grounded and approachable, because patients don't want or need a lecture, especially with like a flood of data thrown at them. So they really just want someone who's kind of like listening to them first and kind of explaining things in a way that feels relevant to them. So, for example, when someone says like the flu shot gave me the flu, you could respond by saying, I can understand why that would make you a little apprehensive or nervous. The good news is that the flu shot cannot give you the flu. They don't contain live vaccines. And feeling a little tired afterwards is kind of your immune system doing its job. And in that response, it just keeps the message like short, straight to the point, empathetic, and it's just like really clear of like what is true and what is not. And the same approach can work across many other myths, just by acknowledging their concerns, gently correcting the information, and just connecting it back to what matters. And whether that's protecting their family, staying healthy for work, or avoiding like a severe illness. And at the end of the day, the most important thing is just keeping the interaction human. When people feel like they're being heard and not being like talked down to or being demeaned in any way, they're much more open to accepting accurate information, and they're much more willing to trust you. And even as the recommendations continue to evolve, they still have that trust, and that you're able to provide them with the correct information.
Absolutely. Thank you so much. And now, in the spirit of actively listening and making sure that we recognize and acknowledge your presence on the call, we want to invite you to please put your questions in the Q&A box and any comments that you have in the chat. Thank you. All right. Now, continuing on, Dr. Amory. As ACIP reviews national guidance, communities look to trusted local providers for real-time information. What are the on-the-ground strategies? What on-the-ground strategies like partnerships, mobile clinic, and incentives have worked for you in practice?
You're definitely right. As ACIP continues to refine the national guidance, we know that communities rely heavily on trusted local providers to translate that information into accessible real-time action. Talking about Module 4, this gives us a clinical foundation. So understanding the flu types, the 2025-2026 trivalent vaccine components, ideal timing, as well as safety considerations. But what truly drives the vaccination uptake are the strategies we implement on the ground. So one of the most effective approaches has been building strong partnerships with schools, community centers, refugee agencies, faith-based organizations, and local nonprofits, some of them that Dr. Demery has already mentioned. These trusted partners help amplify accurate information. We address the myths, some of them that Dr. Demery mentioned, and create welcoming spaces where people feel comfortable asking questions and receiving care. We've also seen tremendous success with mobile and community-based clinics, which remove common barriers like transportation, childcare, demanding work schedules, and digital access, which I discussed earlier in our conversation. In my own practice, I serve as a pharmacist with Giant during the flu season, and I travel to a wide range of locations. For those Giant stores that don't have pharmacies, because several of them don't, we set up vaccination stations. I've also gone to mosques, churches, senior centers, nursing homes, and community centers. So you name it, I've probably been there. Not only do I meet people where they already are, but I also bring other essential vaccines like shingles, Tdap, pneumococcal, and RSV, so that individuals can actually receive multiple recommended vaccines in one place at one time with the maximum convenience. And because I've returned to many of the same community sites year after year, I've actually become a familiar and trusted face. So that continuity builds trust and it helps reduce hesitancy, especially in the communities that have historically experienced inequitable access to healthcare. Another thing we do at NovaScript Central is that we utilize thoughtful incentives. We've given out wellness kits, hygiene supplies, and practical resources. So not as like a transactional tool, but as a way to reduce small but meaningful barriers that prevent individuals from attending. So ultimately, our most successful strategies combine clinical accuracy with community-centered delivery, bringing vaccines directly to people, partnering with trusted institutions, maintaining consistent presence, and ensuring access to a full range of immunizations. So when we create that convenience, the familiarity, the trust, we actually make it easier for every community to receive the protection that they deserve.
Great, 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 great. Very, very well shared. Very well said. Thank you so much.
Thank you.
All right. Now, given that ACIP met yesterday and is meeting again today, what advice do you have for pharmacists who may need to rapidly adjust messaging or workflow in response to updated national recommendations? I'll ask you, Dr. Demery.
Yes. So honestly, anytime ACIP is actively meeting, it's really a reminder that our role as pharmacists is to balance flexibility with clear, and constant or consistent communication. And the updates may shift, but it doesn't mean like when we talk to our patients or when we are communicating with them that our approach has to kind of feel like a little chaotic. The way I think about it is this, like even when ACIP continues its discussions, the core message to patients should still remain the same. Getting vaccinated now just offers that protection, and waiting usually adds more risk and not less. So we don't need to per se like pause our conversations with patients, but we just need to stay ready and adjust the details once the final recommendations actually do drop. And on the workflow side, it helps to build adaptability into your day-to-day operations. That can mean prepping your team in advance, identifying which parts of your current messagings you think will likely shift, and keeping your patient-facing materials easy to update, whether that's like the signage, the handouts, or the EHR prompts. And another idea is really just to have those simple team huddles at the start of the day. I found that can really make a truly difference, just making sure everyone is on the same page. And when the updates do arrive, the best thing we can do is just communicate them calmly and clearly. And patients don't need like the entire ACIP debate or all of that technical information, just like a simple phrase like ACIP updated its recommendations today. And here's what that means for you. That's just like a simple phrase to keep it kind of short, give them what the information that they need. And the response really just offers like that steady guidance and make sure that you have that trust as the core factor in the relationship between you guys. And I also will add that by staying connected with your community partners are really important as well, specifically during like times like this when you have to update information, especially since these are like the trusted places where the patients will go to get information. And it just makes it easier to share those accurate updates quickly, where patients already feel comfortable. And it's really about staying grounded in what we already know, staying aware as things evolve, and responding with confidence and compassion. Pharmacists have been adapting in real time for years. And I don't know if you guys have heard of like this little saying, we aren't new to this, we're true to this. But I feel like healthcare professionals are really like new to this, not true to this. We had to adapt through so many things like COVID, RSV, and all types of flu seasons. So this is just like another moment to show we know how to pivot, especially while still keeping our patients protected.
Thank you very much. Thank you. And that's a perfect bridge to action. That even as recommendations or even if recommendations evolve, pharmacists can keep the message steady, which is that flu vaccinations prevent severe disease and protect communities. Thank you so much. Let's address the questions in the Q&A box. Dr. Demary, the first question is for you. It says you mentioned certain populations are affected more by H3N2 component. What populations are these specifically that are affected?
Yeah, of course. That's a good question. So most populations that we'll see that are specifically affected by this, are older adults. So adults 65 years and older, they can have more hospitalized rates, or more severe outcomes. So they're kind of more high at risk. Younger children as well, just because their immune systems are still developing. So kids under the age of 2. Also, people that have chronic conditions. So, if you suffer from asthma or chronic lung disease, heart disease, diabetes, or just have like a weakened immune system, they're more likely to experience like severe complications associated with like pneumonia or like asthma flare-ups. So, they are also affected population. Pregnant people are also affected as well. Pregnant women are shown to kind of have more severe respiratory illnesses and can be hospitalized for that. And lastly, I would say like racial and minority groups are also affected, just because of like the social determinants of health, just to like the access barriers, structural inequalities, and stuff, things like that. So I feel like the communities, like the Black communities, Hispanic, Latino communities, as well as the American Indian and Alaskan Native communities that we spoke about earlier, these are all of the people that are going to be affected a little bit more by the H3N2.
Thank you.
No
Thank you.
problem.
And the other question is, and I'll ask you, Dr. Murray, what is the impact of the attack on vaccines by the Trump administration in terms of lowered vaccination rates on communities of color and vulnerable populations like the AIDS and HIV population?
Well, that's a little difficult question, but before I answer that, I did want to talk about what exactly is the Trump administration doing. In this current term, the administration has actually signaled that young, healthy people and pregnant women may no longer need the COVID-19 vaccination, which is actually a sharp reversal from actual earlier national guidance. Another thing done by the Trump administration is that they have fired CDC leadership and replaced ACIP members and set up a new panel to review longstanding vaccine recommendations such as measles and RSV. Another example is the hepatitis B vaccine for newborn patients. To answer this question, we don't have perfect numbers tying one administration's actions to a specific group, a specific drop in a specific group with the vaccine. But we do know that when national leaders undermine vaccine programs, it does deepen the mistrust and reinforces misinformation. This hits communities of color and medically vulnerable groups like older adults with HIV that you're asking about. So it does hit them the hardest because they're already living with more health risk and more structural barriers. So every bit of confusion or lost funding will translate into missed shots, more avoidable hospitalizations, and overall, this is going to widen the disparities.
Thank
Oh,
you. Thank you so much. Dr. Demary, did you have something you wanted to add to that?
No, I honestly would just repeat honestly what Dr. Imwari said.
Okay, fair. All right, thank you so much. So we've talked a lot about the modules we created on the CPO webinar. We reviewed the resources, the one pagers that we created at SHC and a few that you both recommend. And now just being mindful of the time, I want to give both of you a moment for your final thoughts. I'm hoping that they are practical, actionable, and empowering for our audience. Dr. Amwari, you want to start?
yeah, absolutely. Before we end the session today, I did want to thank you, Chinny and NMQF, for the conversations today. Honestly, the time flew by. I can't believe we're coming to the end. But I think we've had some very impactful conversations. To share my final thoughts, they're really centered on empowerment for both providers and the communities that we serve. So as we move into this flu season, the most impactful actions are often the simplest ones. As we've mentioned throughout our conversations, listen with empathy, recommend vaccines confidently and consistently, and we need to meet people where they are. So every conversation is an opportunity to build that trust that we've been mentioning again and again in our conversations, dispel that misinformation, and bridge the gaps in care. It's also important to remember that our work actually extends beyond the clinical details. Health equity is advanced through relationships, presence, and partnership. So whether we're serving in pharmacies, schools, community centers, or places of worship, our goal actually remains the same. It's to make vaccines accessible, understandable, and safe for every individual, regardless of their background or their circumstance. So each one of us have the ability to make a meaningful difference this season. So by combining evidence-based guidance with the compassionate communication and community-centered outreach, we can protect more families, we can strengthen the community resilience, and we can continue to build a foundation of trust that'll last us far beyond this flu season. Thank you.
Thank you. Dr. Demary?
Yes, I would just like to build on some of the points that Dr. Inwari raised, just because the season really does give us an opportunity to simply show how we really care for our communities. And as pharmacists, like we mentioned before, we're really some of the first and many, and also in many cases, like the only, touch a point for patients trying to navigate like a very complicated healthcare system. So this just puts us in like a really unique position to make things clear and more accessible for them. And when we talk about like strengthening our approach, it really comes down to being consistent and intentional, like Dr. Nwari stated as well. It just means making those strong vaccine recommendations at every counter, using that plain and relatable language with them, and also designing workflows that reduce the barriers instead of creating them. And something as simple as saying like we can take care of that right now can completely shift the experience for a patient, and a moment that could have been like a missed opportunity becomes like a protected individual. And this work really extends beyond the pharmacy counter. We need to make sure we're showing up in our community spaces, like those churches, the schools, the shelters, and we're not just increasing like access by doing that. We're also like building that long-term trust. And it's so important, especially in the populations where people may not always feel seen or supported in the traditional setting. And that trust is truly what opens the door for people to feel ready and confident enough to take action. And I'll always remind teams, especially that it's really meaningful. Um, progress. Like meaningful progress doesn't have to be like those big dramatic shifts. Like it can be just from small steps, just steady, consistent connection. And every connection, every reassurance, every time we like pause to offer help, it's just like all of those small things adding up that can genuinely change outcomes over time. And you don't have to do everything to make an impact. Like I said, you just have to do something. And that's how we change outcomes one patient at a time.
Thank you so much. And someone dropped something in the chat that I just wanted to highlight and make sure that everybody saw it. I believe one of our panelists has access to an event that's had two events. One is happening on the 16th and one is happening on the 17th, where there will be no cost flu and COVID vaccines offered to participants. The details are in the chat. Please make sure that you copy it if you're in the area or share with someone you know that's in the area. Again, I want to say thank you to everyone who joined us today. And just a quick reminder that we will be sharing all of the resources that we alluded to, we shared, and we talked about on this call, including the Community Pharmacist Ambassador modules, so that you can review and see all of the things that we talked about and highlighted on the call today. And then I want to say, please get your flu vaccine if you haven't already done so, and choose someone that you can help this week. Whether it's a patient, a family member, a neighbor, or a coworker, use one of the tools in the modules and use it again to help someone else get vaccinated. Thank you all for your work and your support in this effort. And with this, I want to say, I want to give you back a few minutes of your time this beautiful Friday and hope that you all have a wonderful weekend. Thank you.